Hi, everyone. It's Leanne West, and I'm president of the International Children's Advisory Network. I just want to welcome you today to Ask the Experts with Anthony Chang. Hi, everyone. Leanne West, president of the International Children's Advisory Network, and we have Anthony Chang here with us to talk about heart disease, pediatric heart disease. And so, as always, though, the conversation can evolve. So if you have any kind of questions for Anthony, please feel free to ask. But Anthony, I'll just let you kind of introduce yourself and, talk about being a cardiac surgeon.
Well, thank you, Leanne. When I was at the age of some of our guests here, around 15, 16 years of age, I wanted to be an architect and had wanted to be an architect since I was about 8 or 9 years old. And I was in high school biology, and because I was doing well in biology, I was invited by the NIH, which is the National Institute of Health, to attend the Saturday morning heart seminar series that the NIH was doing to encourage, I guess, high school students to go into healthcare and medicine. And I was kind of discussing this with my biology teacher, that I really wanted to be an architect and I really didn't want to be a doctor. Well, I hadn't thought about being a doctor, I should say. And yet there were a couple of students in the class that really wanted to be a doctor. I even remember my classmate's name, Errol. I should look up and see what happened to Errol. But Errol wanted to go to this NIH seminar in the worst way, and I felt guilty. And I even tried to arrange it so that he could go in my place. But my high school teacher said, no, technically they want the top student by grade in the class to go. So it has to be you or we can't accept the invitation. So I said, well, I'm going to go if I have to be the one to go, which in retrospect is kind of crazy because I could have totally missed my calling to be a pediatric cardiologist. So each Saturday we would go, and it'll be half a day on Saturday. And the first couple of Saturdays were about the heart and anatomy and physiology, and start talking about adult heart disease. And then the third or fourth Saturday, a pediatric cardiologist was the guest speaker and went on stage and talked about congenital heart defects. And back then, this is 1973, 74. So back then there was no ultrasound or echo. It was mainly angiography, or when the cardiologist put catheters towards the heart and then push contrast into the heart so that you can see by angiography, or essentially like a little movie of the heart with the contrast in the heart showing what the defect was. I just remember sitting there at the NIH auditorium. I was just mesmerized the whole hour. It was just like, this is the coolest thing ever. I just thought, I want to do what this guy does, because this is like the coolest thing I've ever seen in my life. It was just the complexity of the heart defects and the pictures, somehow it just totally resonated with me. It was a huge wake-up call for me that that's what I needed to do. So, but in retrospect, since I want to be an architect, my eventual art history professor at the college at my university told me that, I just have a love for three-dimensional space, and this is just Mother Nature's architecture in a way. So it did make sense in retrospect. But because I hadn't had exposure to congenital heart defects when I was in high school, and up to that point, I really didn't think about it. And so that one Saturday afternoon, I had a talk with my mom and totally changed my sort of direction to be an architect, to be a pediatric cardiologist. I mean, it was literally like overnight. but I still had maybe 1 or 2% of me had this burning desire to be an architect or art historian studying architecture, which I still do. So when I went to college, I went to Johns Hopkins, and you're allowed to minor even as a pre-med. So I was pre-med, but my minor was in art history. So I still had this love for art and architecture. And my art history professor said to me, because I talked to her about, I said, there's still 1% of me want to be an architect and art historian. And she said, this is how selfless my mentor was in art history and architecture. She said, the world doesn't need another art historian, but the world needs some more good doctors. So she said, go be a great pediatric cardiologist. And so I thought I was amazingly, I remember that because it's so selfless that here's someone encouraging me to go into another field because has like the world perspective. And it was almost funny the way she said it. She said, the world doesn't need another art historian. So, and then she said, you can always have art history and architecture as your sort of, passion as a pediatric cardiologist, because I had to explain to her what a pediatric cardiologist was because she wasn't sure. So she said, go be a great one. And just remember me when you look at architecture and art history. So that's what I did. So since that day, that Saturday, literally like that day, I changed my direction, in a big way to become a pediatric cardiologist. So ever since I was 16, I knew I wanted to be a pediatric cardiologist. So when I was in college and med school, and eventually when I was a pediatric resident, because you have to do a pediatric residency first, everyone knew I was like always someone different because no one had really decided on what they want to do, but I had already decided I wanted to do that. Because for me, that field has sort of everything. You have to be good with numbers. Yeah, you do a lot of procedures. You take care of kids. Obviously, it's always a great field to be in, and it's really complicated. So I love that intellectual challenge. And now, in retrospect, looking back, 35 years, 40 years later, I realize that it has additional, benefits. One is because I take care of adults with different kinds of heart diseases, you kind of take care, I've become like a family cardiologist for a lot of families, which I did know about when I went into it. So there are things that you find out after you get into the field. And also there's so many variations of how you do pediatric cardiology. You could be like a radiologist and just look at images all day long, which I didn't want to do. Or you could blend in some ICU, which is what I did. And you can also work on, so there's many areas within pediatric cardiology that you can be interested in, depending on your preference for lifestyle and family and everything else. So it really has given me so much in my career. And excitement, I was what they call a excitement junkie, or I loved fast pace and excitement in ICU. So I got involved in cardiac intensive care for children. And I feel like the excitement in that sort of venue makes the show ER. The show ER was really hot back when I was going through training. It makes the show ER look like a pediatrician's office, just really calm. And, it's like, I felt like I needed that level of excitement. My personality was, I always wanted to be on the go and saving lives and opening, trays to do emergency procedures. That was like totally what I was, really, really fond of doing. And, it's in cardiology is very straightforward. You either save the life for that day or you don't. And I like that really, really straightforward kind of result. And actually I should mention that one of the best dividends, if not the best, is sorry about the antics back there, but it gave me the present of my daughter Emma, because she she has hypoplastic left heart syndrome and had surgery. And if I hadn't become a pediatric cardiologist, I never would have met Emma. So, and then her sister who wants to be a pediatric cardiologist here. She's 7. So in a way, the gift really kept giving and in a big way too. And Olivia's here because she's 7 and she's thinking about being a pediatric cardiologist and a data scientist, which is what I am. And I thought it was just doing what her dad is doing, but her reason is she tells me that because of Emma's condition, she's worried that, if I happen to we don't say the word die, but she said, if you D, who's going to take care of Emma? So she wants to be a pediatric cardiologist to take care of her sister, which is a most amazing, insightful reason to be a doctor, to take care of your family. And she really is actually worried what will happen to Emma after I pass in terms of taking care of her heart disease. So I'm very inspired by that. I just thought it was amazing incentive and insight into being a doctor is take care of your family member. So I'm inspired by what she said.
That is so sweet.
In a nutshell, that's my story. So Emma, you want to say hi real quick? So I think this is one of the best presents, best gifts I got from being a pediatric cardiologist. I never would have met Emma if it wasn't for my career in pediatric cardiology. So, and her sister.
Yeah, I love it. It's so sweet.
Yeah.
Glad you could join us this morning and say hi.
Coming on. I love your glasses, Emma.
Future members of iCAN.
Yes.
Absolutely.
And iSpy probably. So
absolutely.
Hopefully we'll take them to CAN in the summer.
I hope so. They'll love it. All the kids there, they get along so well. Karen, you have your hand up. You have a question.
Yeah.
Hi, everybody. Morning. Actually, recently I just attended a virtual reality and health symposium at Vanderbilt, which was really awesome. But I wonder, Dr. Chang, what you think in the cardiac world. It seems like there's a growing interest in pigs, like, transplants from pigs and stuff like that. And it strikes me, I don't know, it strikes me. I'm not sure how, but I wonder what you think of that in your field.
Yeah, I haven't reconciled with that whole notion of sacrificing an animal to save a human life. It's not very straightforward for sure. And I wish that we could develop modern technology solutions that doesn't involve sacrificing animals' life. On the other hand, I think when you're the family, it's easy to say, well, you shouldn't do it. But on the other hand, if you're the family member of a person that's dying without a transplant, then all of a sudden your personal feelings come to the very forefront, and you have a different feeling. You're saying, well, why not? Sacrificing a pig. I mean, we eat pork, we eat beef. So it gets really controversial, and lots of debates, I'm sure, ongoing about that too. I think that patient died actually recently.
Also, I wonder if this, as someone who was born in the Jewish faith, I wonder how people would feel who are religious Jews, for instance, about having a pig in there. You know what I mean?
Extremely nuanced. So I definitely don't have an answer, and I think it's perhaps not just a societal, but also a personal perspective that's going to be very important. So yeah, that's a very difficult area for sure. And then to have another dimension in my career, about 2.5 years ago now, I got short of breath, and I'm usually in pretty good shape, and I got short of breath after I came back from a trip to Australia. And I thought maybe I threw a pulmonary embolus. And so I kind of checked myself into the hospital. Fortunately, I had a portable EKG device on me. And then I realized that my electrocardiogram had changed. It wasn't looking the same as before. So I figured something really important was happening, medically speaking. And so I took myself to the hospital, and and then long story short, I had something called acute rupture of my mitral valve. So my mitral valve is one of 4 valves in the heart, and it's a pretty key valve because it's allows the blood to come in from the left upper chamber into the left pumping chamber that pumps blood to the heart. So if you have any problem with that valve, it's life-threatening. And so they urgently put me in a cath lab, everything that I'm familiar with on the other side, but not as the patient. And then I had an operation in 48 hours urgently with one of my former colleagues. She's holding the book I wrote. she's like my wing person. Okay. Daddy doesn't like to show off like that. She doesn't mind showing off, but long story short, also, so I had to be urgently operated on, and it turned out that my mitral valve was congenitally weak, not because of anything I did. So the way I explained it to my mom was, it's sort of like having a heart flat tire. So she couldn't understand why all of a sudden my mitral valve gave away. And I said, it's kind of like it's like a flat tire. I had to have an operation, and ironically, technically speaking, I'm actually a congenital heart patient because it was a congenital weakness of the mitral valve that eventually gave out after 60 some years, right? So I have to say it was good that it didn't give out sooner, but on the other hand, it's especially meaningful for me now that I'm in the field that I ended up having the disease in, which happens sometimes to doctors, or they're inspired by, a family member, as in my case, or someone else with a certain disease, and they become a doctor or a nurse or someone involved in that field. It's very relatively common. So, but ironically for me, it was backwards, right? So I didn't know I had a congenital heart defect, and I ended up having one. So, and having been a pediatric cardiologist for 4 decades, so that was especially meaningful for me. And so now I can actually tell my patients, when they ask me, what is it like to have heart surgery? I can actually tell them from a personal perspective, not just what I'm hearing from my patients and families. I can say, yes, when the chest tube comes out, it's going to be the most amount of pain you'll ever feel in your life, So I actually experienced it. So, so having gone through my daughter's heart surgeries and my own heart surgery, I can definitely tell people, what it's like to have heart surgery, which is one of the most common operations, that we have in medicine. So in a way, I have to say, if I had to have one disease, then I wouldn't mind having heart disease because I'm so close to that field. And good and bad, right? So the bad is that everything that's happening. But I'd say the nurses and the doctors, reaffirmation of how amazing nurses are. The doctors come and go very quickly during the day, but gosh, the nurses were so inspiring for me,
Yeah. So we actually have a couple of questions for you in the chat.
Yeah.
One of them from Mary Rose says, how do you think that we could make it easier for kids to find out about different medical careers that are not very common?
What a wonderful question. We need to do a better job, don't we? Maybe I can be that sort of organization, not just talk about diseases, but talk about different fields in medicine and healthcare. What doctors do, what nurses do, what some specialists do. Maybe, Leanne, we can take that on. I think iCAN might be the best organization.
I know
you do a great job with patients and different sub areas, but maybe being a doctor or nurse in those areas would be also a nice, I don't know if that's your mission and vision, but
Yeah,
there's really
I know.
nothing I can think of that does that.
Well, we do have on the phone Rhiannon, who is our new young adult professional chairperson. And Rhiannon, I'm just thinking that maybe we could talk about that with the young adult professional group. That might be an interesting thing to undertake. I I do think that iCAN could be a really great resource in this area for sure.
Yeah.
Yeah, and Mary Rose even added, like,
Um,
could we make a program in schools that focus on different medical careers? And maybe you start an iCAN chapter at your school, and that's something you can do is bring in clinicians to talk about different careers or something like that.
And it's so important now, Leanne, because as you know, something like a quarter or a third of clinicians, doctors and nurses are planning on leaving the field in the next few years
I know.
because they're so burned out. They're so fed up with everything that's happened. I'm talking about mainly the US, but you know what's happening in other countries too, in a way. And fortunately, I'm not one of those people. I feel like I'm savoring my last few years of being a clinical doctor. And I want to keep going. So I feel very fortunate that I'm not burned out, but
Yeah.
a lot of doctors and nurses are, and yet more young people have applied to medical schools than ever before, and true in the US, and I was just told true in the UK also. So in a way, I feel especially inspired by that, despite the fact that healthcare can actually be, you can actually lose your life just like a soldier in war. Doctors and nurses can lose their lives now doing what they do on the front lines. I'm about to go see 15 kids and families. Any one of them could be infected, and I will be infected. So it totally changes your perspective of being a doctor or a nurse. But I'm inspired by the number of young people that are still saying, you know, I still want to be a doctor or a nurse. And we really, I think, need to do a better job of giving them opportunities to hear about different fields. We do that as part of the summer internship program, but it's really 15 and up. But perhaps between, like, you know, 8, 9, and 15, we need some resource for the young people at that age.
Yep. So we have another question from Reese, and she asks, did any other specialties within the medical field interest you before you chose cardiology? Stories about rotations during residency always seem so interesting.
Yes, 2 stand out in my mind. I ended up doing cardiology and intensive care, which were my 2 primary loves. I was distracted by OBGYN, obstetrics and gynecology. I love the fact that that a doctor can do both the medicine part and the surgery part. You know, I'm a pediatric cardiologist. The only thing I don't get to do in terms of taking care of my patients is the heart surgery itself. And I actually at one point thought about this crazy notion of being both a pediatric cardiologist and a cardiac surgeon for kids. And I added up the number of years of training. That would have been like almost 20 years of training, if you can imagine. And a good third of that will be working with adults. I have nothing against working with adults, but I really want to work with kids my entire career. So that kind of discouraged me from pursuing that, you know, being a pediatric cardiologist and a heart surgeon. And then I found out there's actually one such person in the entire world. He's both a pediatric cardiologist and a heart surgeon. So someone actually has done that. But I wanted to do it, but I just didn't want to sacrifice, you know, 7 years essentially working with adults only, pretty much.
Yeah.
So, but yeah, so it's a great question.
All right, we have another one. In the beginning of your career, how'd you cope with unfortunate situations where your patients passed away?
Yeah, that's still the toughest part of my job, is to sit down with parents and explain to them that their child had passed. Still by far the toughest part of my job. And ironically, I've become really close friends with some of those families because I think they feel like I was there with them at the hardest part of their lives, and they didn't want to say goodbye to me after their child had passed away. And I've maintained friendships with maybe a few dozen families like that, including some of my closest friends, actually. So I'm one of those doctors that break the rule of don't socialize or become friends with your patients and or patients' families. I feel like, why shouldn't you be able to? These are some of the finest people you ever meet. And perhaps if you're actively taking care of them, that might be a conflict of interest, but there's no reason why you couldn't be friends. And I go to my family's, my patients' families' birthdays, weddings, graduations, and occasionally funerals all the time. I feel like it's a special privilege that they invite me. And I'm never going to pass up an invitation. I'll work around my schedule to go to these. I feel like it's a very special invitation. It means a lot to these families when you show up, especially the funerals, because you've worked so closely with the families and you've known the child or the young person so well. The families always wanted me to say something at the funeral, and I just think that's the only time I think in my whole career that I will lose my voice or not be able to talk is when I have to say a few words for those families. It's really, really difficult for me emotionally to put myself in their place, and especially now that I'm a parent of a child with congenital heart defect.
Yeah.
Even more poignant now for me. So I do a lot of public speaking, but it's probably the most difficult task is to deliver a speech at a funeral for one of my patients that passed away. Fortunately, I'm obsessive compulsive, and that doesn't happen to me often, but when it does happen, I get invited. And sometimes children and young adults just die of their natural heart disease, and nothing I could have done different. But it's a special honor for me to be asked to give a talk at the funeral.
And I'll say, in talking to a lot of our kids, they'll tell you that they want to get to know the doctor. They want the doctor to know them on a personal level. That makes them feel more comfortable and better while they interact with the doctor. So I think that you becoming friends with them, it just makes sense. You're going through a really hard time with them, and you're there to help them. And I think that that's also really appreciated from the patient side.
But I think the vast majority of doctors, though, Leanne, would not support that nor recommend that. Definitely,
which is interesting.
Yeah, I'm definitely in the tiny minority that will do that. There's only one other doctor, for instance, in my hospital that will give all of our patients our cell phone numbers. Also in the tiny minority there. And I'm not saying I'm special or even that very different, but I just have at least a different perspective on how access and closeness of the relationship we should have with our families.
Yeah.
And you get very close, emotionally close to these families. They've shown you their weaknesses. I mean, I just feel like they feel so vulnerable if I abandon them, if they want to be friends with me. And if I say no, I feel like it's, in a way, for me, it's abandoning them in a way, right? Because you feel like, okay, you're good enough to be my patients and family members during a crisis or during illness, but I don't want to have anything to do with you when your child is healthy or after your child's passed. I just feel like I don't feel good about that. So.
Yeah. All right. We have another couple of questions. I know, Rhiannon, you have your hand up, but we had one more before that, I think, from Reese. In terms of psychology, how do you prepare pediatric patients for operations? I know you talked a little bit about your own experience with a heart operation, which I think is incredible.
Well, now I use my own heart operation to my advantage, and I explain to them what that's going to be like, and because I've actually gone through the experience firsthand. Before, I was just doing my best to explain to them, that they shouldn't feel, they'll feel some pain occasionally, but they shouldn't feel too much pain. They're going to have a lot of pain medications, and the nurses are great taking care of them. And I have, when the families always go through the ICU part, so they know what it's like. Obviously, that's a hard part of their orientation, but I think it's important for them to preview the ICU rather than seeing it for the first time after heart surgery.
Yeah.
I try to have even 8-9-year-olds really start taking over their own knowledge of their heart disease and medications and why they're taking those medications and the reason for it. And probably a little bit earlier than most cardiologists would do. But I feel like, when you're 7 and 8, you're getting knowledgeable about things. And I'm always surprised about how much kids understand, even about death. I talk to kids about death, which is also something that most doctors wouldn't be willing to do. I've had, and some families wouldn't let me do that. I've had families of 20-some-year-olds tell me that, they don't allow me to talk about death with their young adult in the family. And I always try to work that in and have their permission to talk to anyone in their family about death, the finality of death. And but I can't remember a family, ever not allowing me to do that after, persevering a bit, so almost all families will give me that opportunity. They kind of look at me in a way as someone with a priest function almost, right? That I care about them deeply. I happen to be a medical expert, but in a way I bring comfort to their family, and they eventually will trust me having a discussion with their family member that will probably have very limited time. And the thing is, even the 8-9-year-old really most of the time really do understand death and the finality of death. And we just don't give them credit for understanding it. We want to, I think, have this false sort of assumption that by not talking about it, you're protecting them. But I think it's the opposite. By not talking about it, you're actually, I think that's not very productive for them, because most of them kind of understand.
Yeah.
I've had 8-year-olds that come up to me and say, Dr. Chang, I feel like I'm going to die in the next year or so, and they talk to me about it, and they'll tell me to protect their parents, which is ironic. They'll say, can you not talk to my parents too much about it? Because I think they're kind of worried. Which is so ironic that children are telling me to protect their parents rather than always we assume the other way around.
Yeah. Okay, Rhiannon, I see your hand up. So do you want to ask your question?
Sure. So you mentioned, Dr. Chang, that it's important for doctors and patients to have a relationship. And as we continue to do these meetings, I think it's always been a point that the relationship between doctors and patients are kind of strained, and that it's something that patients kind of wish that they could improve. So I guess the question is, what do you think we could do to make that improvement? Like, what are the steps for us to bring this to the forefront and talk about it in a safe environment, and also make patients feel as though they're being heard?
Well, I think through meetings like this, and also, the iCAN meetings, we've had a few doctor and patient sessions, right, together, like what a child wished their doctors would understand. And then from the doctor's perspective too, what we wish families would understand and appreciate. And I think just really, really transparent discussions about, I can't believe my own daughter just yawned and looked bored when I'm talking. She's like, I got busted. No, she's denying it, of course. No, I think just really, even though these discussions can be very hard and awkward, I think we need to have them. It's like when you address something that's awkward, then it becomes less awkward. I'm always, thinking that. And I think with maybe the iSpy meetings and iCAN meetings, we should, as you recall, Leanne, for the iSpy meetings, when I used to organize them, I always have a patient first during the day. And because I do feel like that should be our North Star always. And sometimes when you go into the meeting, you have a natural tendency to forget about that while you're there. So I think just having a lot of open discussions and people on both sides be willing to have awkward conversations, even in public. I feel like almost all families, even the ones that are considered difficult, I think because people sometimes ask me, how do you deal with difficult families? And I feel like there's no difficult family. They're families with a difficult situation. So I think if you change your mindset into thinking that these are not difficult people, these are just difficult situations that people have to face and have some empathy. And sometimes you have to have a lot of empathy for sure, but have the empathy and patience. And I think the number of families that are truly difficult, by not just by my assessment, but by other people's assessment, I can count on one hand with fingers left over after almost 40 years of practice. It's just so rare that families are just impossible to deal with. I think they have near impossible situations that they're faced with. And as you know, when you have a family member with an illness, it tends to magnify all the pathologies in the families and all the issues that the family dynamic has. So it kind of exaggerates all of those things, unfortunately, for these families. It's like the pandemic, it's brought out the worst, and it's also brought out the best in people. So, and I think that's happens when a family has a family member that's really sick. So, and I think especially having these two really gave me an extra level of patience now that I perhaps still needed to work on before I had the two girls. And I think patience is a true virtue when you deal with families, for sure. But again, it's not difficult families, it's families with difficult situations, which is very different.
Yeah. I completely believe that. I mean, even with my own experiences, sometimes I know I'm being difficult, but it's also I'm trying to understand or get through whatever I'm dealing with that day. So
Yes.
I understand that.
But I think, ultimately what really gets these families around that are really difficult for some people is, I think, quickly identify why you're all there is for their child's benefit. Like once they hear from me, things like, I'm your child's health advocate. I'm going to do everything I can to help you and your child. And, you swing yourself on their side. I think it really neutralizes a lot of negativity on their part. They realize that you're on their team, and you're a privileged member to be on their team. There shouldn't be any differences. It's just you're on the same team. And they love hearing things like, I treat your child just like I treat my own, not exactly the same, because that's not possible, but just as close as possibly can to be like my own child. This is what I would do, and when they ask me that, and sometimes they'll ask you that question, difficult question. What would you do if this, if Sam was your child? What would you do? Go ahead for a forced transplant or whatever horrible medical dilemma they'll ask you. What would you do if Sam was your child or Anna was your child? What would you do? And you have to answer that question for them. As difficult and awkward as it is, you're expected to be someone, especially if you're a senior cardiologist, to have that answer for them. That's what they need from you. They need that. But having said that, families put up with a lot. I'm a busy clinician with a lot of things outside of my clinic, and a lot of times I have to change schedules, and I almost never hear from my family that tells me, I can't have you see my son anymore or daughter anymore because, our clinic appointment got changed, twice, last year. And so I'm really grateful for my families to be that loyal to me. I don't take it for granted. But on the other hand, I'm loyal to them. So
we have another question. I see Karen's hand up, but we have another question in chat from Mary Rose. And she said, if you're having a bad day, how do you calm down and just try to understand your patient?
Great question. First of all, I meditate about 3 times a week. I think that helps so much. If our young people could just learn about the benefits of giving yourself 15 minutes 3 or 4 times a week of meditation, it really grounds you. It's hard to be rattled on days that I've meditated. If I have my big long day on Mondays where I see about 25 patients and families, and almost all of them, it almost feels like a social event. And I'm just taking care of their family members' hearts. But occasionally there's, towards the end of the day, let's say there's a bad situation, or not a bad situation, but just something that isn't as smooth. I just, take a deep breath, think that I'm there for them. It's not about me. And I think perhaps that's the best answer I can come up with is it's not about you. And don't take anything personally. Make it personal, but don't take it personally. There's a difference. Make it personal, trying to re-emphasize to them that you're there for their child. And also remind yourself that it's not about you and your feelings. At least when you're in that role, it's about the family in front of you and their feelings. And you kind of just swallow your pride and apologize, even if you think it's not your fault for a negative interaction. I would say 99% of the time that family's going to turn around. I had just one a few weeks ago. It was entirely not my fault that I had to basically cancel a surgery of this family for a plastic surgeon. It was not a sort of essential operation. And I felt like the child was not in a position because of a recent COVID infection to have that operation. Well, this family has 7 children that I'm following. And that was the last thing that they showed me their calendar, of appointments with doctors. And they were just livid in the room that I was canceling or postponing, I should say, their child's surgery. And I was caught in that awful, situation where they were just yelling and screaming. They said, tell me basically they can't take it anymore. And I just said, that's the time that you just let them decompress, and you can't react to their being really mad at the situation. And again, make it personal and make sure that you're their advocate, but don't take anything personally. And I didn't take that personally. I just felt like it was a situation that they were upset with. And I just, reassured them that I'm on their side. I will call the plastic surgeon to explain to them what the situation was. And ultimately, if you say things like, this is very uncomfortable for me to cancel the surgery, but ultimately I'm your child's health advocate. I have to do what's best for your child, even if it means that you're going to be mad at me. And as soon as I said that, they felt guilty that they weren't really mad at me. But they said immediately, I'm so sorry. You're so good to our children. We tell our friends all the time about you. And they went on. And it totally kind of diffused the situation. As soon as I said, please be mad at me because, I can take it because you deserve to be really, really upset with this whole situation. And it's almost like it disarms them immediately. And they just apologize. And then they came back the following Monday because I'm following 7 of their kids. They have 7 kids with medical issues. So I said, I can totally relate. And I bring in my own personal experience, right? So when I say don't take it personally, but make it personal. So I'm stealing that phrase, by the way, from one of my friends. But
I like it.
But I think it's important to remember that. Don't take it personally, but make it personal. So I tell them, I don't tell all my families, but I have 2 children with medical conditions. I understand what it's like to have, 5 appointments in 2 weeks, and I have to rearrange my own schedule. And when I get a cancellation, it is not a good day for me, because I rearrange my own schedule. So then they can relate to what I go through. I said, I don't have 7 children with medical conditions, but I have 2. And I said, I can definitely, I think if you appeal to how they're feeling and recognize it and accept it, it really helps to neutralize their negativity. And they say, okay, well, he's not only a doctor, but he is a parent with children with medical conditions. And then on top of that, saying, just please be mad at me and let's move forward after that. It really kind of quickly really relieved the tenseness of the whole situation. Yeah. I was uncomfortable because I had my scribe with me, had a team with me, of visiting doctors with me. And there I was facing with a situation that you never want to face, which is sort of have a public display of a negative interaction with a family, because it's almost always positive for me. But it was good for me to be able to get that family's trust back very quickly.
Yeah. So Karen, I know you have your hand up, but I have a question in the chat from a kid. So we're going to answer that one first, if that's okay. Reese asks, what advice would you tell a young person who is interested in going into medicine about working in the field. And then there's another one from another one of our children. And it says, do you have to independently learn the skills on how to understand and connect with your patients, or was there someone who guided you? Can you explain about the process about learning these skills?
Yeah.
So what advice?
Yeah, I think it's never too early to learn these skills. And we don't do a good job even teaching medical students how to diffuse a tense situation. You just kind of have to, and I think there is a certain art and science to this too. Now, I came from a family that was not very well off, so we all had to work in the summers to build up our bank account for school. And I feel like being a waiter for 10 years and have to deal with a lot of tense situations when a restaurant's busy or when a customer is very difficult. Really, in retrospect, while my wealthy friends were traveling Europe for the summer, I was stuck at home working in restaurants, and sometimes 2 restaurant shifts, and then tend the bar when I was old enough. I felt like all of that came back to me, and in a positive way, that it really taught me how to deal with difficult people. How do you manage like a clinic when you're 4 patients behind? I learned that from waiting on tables.
Yeah.
That your customers are very happy with you if you at least stop by and say hi, bring them water, and say, I'll be back and take your order. You've recognized the fact that you're not ignoring them, that they're waiting there, right? So it's funny because one of my interns said to me, I noticed that when you're even 2 patients behind, you'll go say hi to the second family before you see the first family. Why do you do that? I said, it's because I know that once I recognize that they're there, they're very forgiving if you're going to be another half hour. But if you never stop by and you're popping in the room for the first time, 45 minutes later, they're not going to be as happy with you, So I've learned to do that, which is funny, from waiting on tables, that you always try to distribute your time very strategically so that everyone gets your attention. And then, but, one table or one family is always going to get your attention, first, but you're not ignoring the rest of the families that are waiting or the rest of the tables that are waiting. So I think having work experience helps a great deal.
Yep. And I will say that working in a restaurant definitely makes you get used to a lot of things in life.
Especially on
makes you a better person.
Mother's Day, right? You don't have a prayer of catching up all these tables that are streaming in. So I think waiting on table on Mother's Day is a great way to manage your manage your life, because that's an ultimate challenge.
Yep. And so we have just a couple more minutes before you said you have to hop off. So Karen, if we want to ask your question really quickly.
Hi, related to time, this is probably a longer conversation, but I don't know how it works in pediatrics these days, but regular Western medicine, there's so little time for doctors and patients to spend with each other. And the listening piece that's so important in that relationship seems to be lost. It's so transactional. I don't know how it is in pediatrics, and I just wonder how you feel about future generations in Western medicine and how it can approach that in a different way, and can it?
Well, it's a universal problem. It's not just in this country. If you go to China, you literally have 2 minutes with your doctor if you have a doctor's appointment, because they see 30 to 50 patients an hour. So if you think it's bad here, there are places around the world where it's even less time with your doctor. So I don't think it's really time. It's 15 minutes versus 30 minutes. I spend sometimes just 5 to 10 minutes with my families and patients because 1, I know them really well. 2, they have access to me 24/7 with my phone. And 3, I do things I've learned that makes the families feel like they're not being rushed. So the first thing I do when I go into the room is I sit down. I'm at eye level with them. A lot of doctors don't do that. So if you sit down, the families feel like you spent 20 minutes with them when you've spent only 5 to 10 minutes, because it's that direct interaction, eye-to-eye contact that I insist, our doctors do. And we have a scribe, so I'm never distracted. I'm never on the computer in the room. That's my personal rule, is never tap on the computer or whatever when you're in the room with the patient and the family. And always eye-to-eye contact and always at eye level. So I never sort of stand when I'm talking to the families. I'm always sitting down. I'm always eye to eye. I never tap on a computer the whole time I'm in the room. And I always tell them that they have my cell phone. If there's any questions, after we meet, they're free to call me and text me. And I think, I worked hard to make sure my patient satisfaction is way up there. And I think they feel that, they feel like I do have a lot of eye-to-eye contact with them and interaction with them. They don't feel rushed. I think the fact that I pop in if I'm a little bit behind, proactively, I think that helps to not have the families be irritated that they have to wait 45 minutes in the room after they get into a room. I never let a family sit in the room that long without some interaction with me. So I work hard. And again, it's from work experience and learning how to manage that and reading. You have to read about how to satisfy customers and clients and patients. There's a lot of literature out there, and I learned that sitting down and listening first. You'd be surprised that, well, maybe not surprised. What's the length of time would you think that a patient can talk before a doctor interrupts?
1 minute.
7 seconds.
Oh my gosh. Wow.
So we don't let patients talk, apparently. So I was like shocked by that. Then I realized
I am too.
Then I realized I'm kind of guilty of that, So when I say, tell me about your chest pain, and then I'll let them go a good 2 or 3 minutes before I ask my next question. Because a lot of times I don't even have to ask questions. They're telling me everything I was going to ask anyway. So by them, talking without interrupting, without being interrupted, I think matters a great deal. And I definitely learned that a little later in my career. I didn't realize that was interrupting, because we're not really interrupting. We're just want to get right to the crux of the problem. And yet a lot of times that information comes to you anyway by listening to your patients more. And because, especially younger children, you don't always have the patience to, they'll talk about their, they can go on and on, but just have a little more patience and not interrupt your patients, I think goes a long ways.
That's amazing. So I know we're a little bit past time that you wanted to leave, so I'm going to let you go so you can do rounds, but I want to thank you so much for all of your insight today. I learned a lot today.
And thank you for the questions from the.
Thank you so much, Dr. Chang.
Yeah, great questions today from everybody. So
Dr. Chang, before you leave, I'm sorry to cut you off, Leanne, but you mentioned having a part of the young professionals group and making kind of like career job fair thing open. If you wanted to meet up one time, I guess, or on Zoom, and we can talk about those different ideas, that way we can get that going in iCAN, that would be great.
Yeah.
And maybe we can have a Q&A session like this at iCAN meetings and iSpy meetings as well, so.
Yeah, so let's we'll definitely sit down and talk about that, Rhiannon, and probably bring you in, Anthony, if you have time for us one day.
Yes.
But I think it's such a great idea. I think it's so important. And I think so many of the insights you gave today really help, will really help kids understand if they want to go into a career in medicine, how to do it and do it well. I think you set a great example, and I just want to thank you for all of that.
No, you're welcome. And thank you for all the questions and the interaction. I really enjoyed it myself. So thank you.
Good. All right, everybody have a good Saturday. Have a good weekend, and we'll see you next month.